Thank you. My name is Mr. Jake. Today we are going to continue our OET reading test 2 part B. We are going to solve question number 3 and 4. If you are new, I have old videos. You can look for them on YouTube and watch. Be a loyal member, like my videos, share my videos, and help this channel to grow. Let's form strong community. Join me in the quiet room and let's solve the questions on the whiteboard. My name is Mr. Jake. I'm your facilitator. Question number 3. The report mentioned in the memo suggests that. Alright, so let's go to the extracts. Memo. Reports on oral anti-cancer medications. Nurse unit managers are directed to review their systems for the administration of oral anti-cancer drugs and the reporting of drug errors. Serious concerns have been raised in recent reports drawing on a national survey of pharmacists. Please note the following paragraph quoted from the report. Incorrect doses of oral anti-cancer medicines can have fatal consequences. Over the previous 4 years, there were 3 deaths and 400 patient safety issues involving oral anti-cancer medicines. Half of the reports concerned the wrong dosage, frequency, quantity, or duration of oral anti-cancer treatment. Of further concern is that errors on the part of patients may be underreported. In light of these reports, there is clearly a need for improved systems covering the management of patients receiving oral therapies. Again, after reading the extract, try and break it down in your own words. So you pause, you think about it, and you break it down. For the first paragraph over here, I can say we are introducing serious concerns, okay, which has been identified. So we are drawing our attention on serious concerns in the first paragraph. Then when you go to the second one, here they stated the concerns, okay. So I can see over here that we have half of the reports concerned the wrong dosage, frequency, quantity, or duration of oral anti-cancer treatment. Then they went ahead to say that of further concern, which means the serious one, or let's say the major concern is that errors on the part of patients may be underreported. Okay, so there's concern. Half of the reports is concerned about wrong dosage, frequency, quantity, or duration of oral anti-cancer treatments. Okay. However, major concern or further concern is that errors on the part of the patients may be underreported. So these are the concerns. Okay, they saw some serious concerns. Okay, so now let's go to the question. Question number 3. The report mentioned in the memo suggests that. Alright, so option A, data about patient errors may be incomplete. Is that provided? Well, we can jump over this and come back to it again. Then B, errors by hospital staff can often go unreported. Alright, so errors by hospital staff. Was this information given? If you look at it carefully, I can see something similar here. Errors on the part of patients. Okay, so that is patients, not hospital staff. That makes it wrong. So this information is wrong. Then C, errors in prescriptions pose the greatest threat to patients. I know this can be very confusing because here it is indicated incorrect doses of oral anti-cancer medicines can have fatal consequences. Okay, we have oral anti-cancer medicines. Over here we have errors in prescriptions. Okay, so this is quite general. It's not specific. Once it's not specific, it is not addressing or paraphrasing this sentence. Okay, so that makes it wrong. So the best option to select is data about patient errors may be incomplete, or because here we have of further concern is that errors on the part of patients may be underreported. So underreported is like not giving complete information. So it's incomplete. Question number 4. What point does the training manual make about anesthesia workstations? Anesthesia workstations. Studies on safety in anesthesia have documented that human vigilance alone is inadequate to ensure patient safety and have underscored the importance of monitoring devices. These findings are reflected in improved standards for equipment design guidelines for patients monitoring and reduced malpractice premiums for the use of capnography and pulse oximetry during anesthesia. Anesthesia workstations integrate ventilator technology with patient monitors and alarms to help prevent patient injury in the unlikely event of a ventilator failure. Furthermore, since the reservoir nag is part of the circuit during mechanical ventilation, the visible movement of the reservoir bag is confirmation that the ventilator is functioning. Alright, so based on what we just read, human observations at the anesthesia station is seen as not enough. So they have improved, it has led to improved standards for the equipment design, okay? And because of that, they use capnography and pulse oximetry during anesthesia. They have added additional ventilator technology with patient monitors and alarms to help prevent patient injury, okay, in the unlikely event of a ventilator failure. That is, if the ventilator fails, or they've added this to ensure patient safety when the ventilator fails. So that is not alone. They also have the visible movement of the reservoir bag, which confirms that the ventilator is functioning. So there are many ways you can confirm ventilator is functioning or the anesthesia workstation is safe. Question number 4. What point does the training manual make about anesthesia workstations? A. Parts of the equipment have been shown to be vulnerable to failure. Is it indicated that way, that part of the equipment has been shown to be vulnerable to failure? B. There are several ways of ensuring that the ventilator is working effectively. Is it also indicated that way, that several ways of ensuring that the ventilator is working effectively? Then C. Monitoring by health professionals is a reliable way to maintain patient safety. Is it really true? I think that is false, because they've indicated human vigilance alone is inadequate. Alright, so the C is out. The B, there are several ways of ensuring that patient ventilator is working effectively. Well, I can see we have the patient monitors and alarms, okay. We also have the visible movement of the reservoir bag, and it shows confirmation, okay. It confirms that the ventilator is functioning. However, the part A, parts of the equipment have been shown to be vulnerable to failure. For this, I think they did not state it direct like that, but they said in event, okay, of failure. So it is not stated clearly. Alright, thank you for your time. We will meet again to complete the question number 5 and 6 in our next recording. My name is Mr. Jake.